Hi, my name is Brian Byrne, and I'm here to talk to you about osteosarcoma. Osteosarcoma is known as an aggressive and malignant cancer that starts in the bone cells and then, over time, grows and divides uncontrollably. The cells then make immature osteoid cells that form a tumor within the original bone, usually a long bone. If given the time to develop, osteosarcoma can metastasize to different parts of the body. Most commonly, it'll spread to the lungs first. There are five main subtypes to osteosarcoma. The first one being osteoblastic osteosarcoma. This is when the cancerous cells have a similar look to osteoblasts. If the cancerous cells inside of the body are not only forming bone but other substances such as cartilage, this is commonly known as chondroblastic osteosarcoma. When there is a minimal amount of bone cells being produced in the tumor, this type is classified as fibroblastic osteosarcoma. If there is a massive amount of bone cells being made in the tumor, this is usually classified as telangiectatic osteosarcoma. When there are small round cells within the tumor, this is usually classified under small cell osteosarcoma. Osteosarcoma is most commonly formed sporadically, and the person affected usually has no prior background or risk in forming this cancer. However, there are still multiple risk factors that are included. Upon these risk factors is age, as osteosarcoma most commonly develops in children due to the fact that they undergo growth and development during childhood and puberty. This makes bones much more susceptible to bone cancers like osteosarcoma. Another risk factor is genetic predisposition, as some people inherit damaged genes or diseases like retinoblastoma that increase the likelihood of developing osteosarcoma. There are multiple signs and symptoms used to detect osteosarcoma developing in the body. The most common symptom is the pain that develops alongside osteosarcoma, which is known to increase over time and at night, and usually produces a limp. Another very common symptom of osteosarcoma is the swelling in the affected region. This is usually due to the constant pain produced by the developing tumor. However, it should be noted that these symptoms are very common through an active lifestyle of an adult or a kid, and should not prompt a doctor's visit immediately whatsoever. The last symptom I'm going to be covering is the weakening of bones from the cancer cells spreading throughout the body. It is possible for these bones to eventually become so weak that they are capable of snapping due to the slightest bit of pressure. If a person is skeptical about having developed osteosarcoma, multiple steps and procedures are done in order to properly diagnose a patient with osteosarcoma. First, a doctor will perform a physical exam to examine the area in question for tumors or unexplained growth. They will also do a medical background check to see if you've had any risk of developing osteosarcoma previously. If a medical professional detects any sign of osteosarcoma, one will go through image testing, as which an X-ray is used to project a picture of the inside of your body, which is used to locate the tumors which have formed due to osteosarcoma. After a tumor or lump is detected, doctors often put the patient through an MRI, which uses radio waves to produce a much more in-depth picture of the body, which allows the doctors to identify the lump as an infection, tumor, or other type of damage. To see how far the osteosarcoma has spread, a CT scan is used, which is multiple X-ray pictures that are taken from different angles in the body to see the extent of the tumors and where the tumors have spread to. A PET scan is another way to determine cancer. This is a process in which the doctor injects you with a high dose of radioactive sugar. This allows the cancer cells to absorb it, then this allows the scans to be able to show the location and the degree of these cancer cells. Treatment for osteosarcoma varies from the extent, the stage, and the location of the cancer. The two variants of surgery used to cure osteosarcoma is limb salvaging and amputation surgery. Limb salvaging surgery is demonstrated when the surgeon removes the infected bone, then replaces it with an internal, artificial, prosthetic bone. Amputation is demonstrated when the surgeon completely removes the limb and then replaces it with an external, artificial, prosthetic limb. Chemotherapy is another treatment that can be defined as the use of drugs to kill, in this case, cancerous bone cells that have spread throughout the body. Chemotherapy is often used in a combination of other treatment options. Chemotherapy is most often used when a cancer has metastasized throughout the body because the drugs can travel through your bloodstream and kill or weaken the cancerous cells that have spread throughout the body. Radiation therapy is not common, as it is usually ineffective to osteosarcoma. It is usually only used when the cancer develops in hard-to-reach places such as the jawline. The most common and effective treatment for osteosarcoma is the combination of chemotherapy and surgery, as doing chemotherapy pre-surgery will weaken or kill the cancer cells in the body. Limb salvaging or amputation surgery allows for the removal of the initial cancerous tumor, and the post-surgery chemotherapy allows for the remaining cancerous cells in your body to be exterminated. The financial impact and aspects of osteosarcoma can be devastating to a person without the proper healthcare or knowledge of how to deal with this type of situation, but by being prepared and ready for the financial responsibilities that will come with being diagnosed with osteosarcoma, a patient or the family of a patient will be able to survive the financial repercussions. It should be noted that there are multiple cancer groups and societies that help patients overcome their financial issues that were produced by cancers. Age and income can also impact the assistance you receive. For example, if a person is considered a minor or over the age of 65 and is considered elderly, programs such as Medicare and the California Cancer Youth Society will help cover the financial impacts of disabilities such as cancer. If you are a person that is unfortunate enough to have a low income, Medicaid will help cover your financial debt. Through the help of health insurance and cancer societies, the financial responsibilities of treatments, surgeries, medication, physical therapy, and much more will cost next to nothing, but only if you are prepared and responsible in this situation. That pretty much wraps up my video presentation on osteosarcoma. From personal experience, there are a couple things you need to keep in mind in order to overcome an obstacle as big as this, and that's to be prepared, to be positive, to be calm, and to be ready for anything. Thank you for watching, and I hope you enjoyed it.